PCT, these are the sites of nephron, PCT, then loop of Henle. This is the descending limb, ascending limb. Okay, this is the DCT again. This is the proximal and the distal part. There are pumps present over here. Please do study these pumps because it is really very important. In PCT, there are mainly 65% of sodium is getting absorbed. Okay, with the mechanism of what transport? Active transport. Okay, so see, there are symport and there are antiport. Okay, symport means what? It is getting sodium and glucose inside, that we call as SGLT2, isn't it? SGLT2 I call it. Okay, so symport SGLT2. Then there will be sodium HCO3 co-transport. Okay, sodium phosphate co-transport, sodium with sodium phosphate, sodium amino acid co-transport. Means what? From the lumen, this is the lumen. Look over here. Just a minute. It is getting here. Yeah. From this lumen, we are getting sodium and what? Chloride. Definitely chloride. Sodium and amino acid. Sodium and glucose. Sodium and HCO3. Everything has been written over here. Okay. Then number 2. This is very important. This is sodium potassium 2 chloride. Okay, so at the ascending limb, actually it is at the ascending limb present over here. It takes 2 sodium, one sodium, 1 potassium and 2 chloride inside the cell. Then there will be sodium calcium exchange. Here PTH works, and finally there will be aldosterone action that is leading to potassium potassium secretion. See, look over here, potassium is always secreted. See, whenever you are talking about kidney, you remember some basic ground rules, that what we have to absorb and what we have to secrete. See, absorb and secrete, remember like this. So what we have to absorb, you remember, we want to absorb water, we want to absorb sodium, we want to absorb amino acid, we have to absorb glucose, we have to absorb what else? Anything else? Calcium, we have to absorb magnesium. What you have to throw, what you have to secrete? You want to secrete creatinine, you have to secrete potassium. See, potassium is absorbed also and secreted also, so you can put it in both the side. Potassium you have to secrete main most important H plus ion. Okay, so H plus, that is very much important. H plus you have to secrete. That is why acidification of urine we say. Okay, so you have to secrete H plus. You have to secrete phosphate, PO4 minus. Okay, PO4 minus, phosphate. So this is what you have to remember. In kidney, if this doesn't happen, any kidney disease, you see, if it is CKD, what is going to happen? This function is not done, so creatinine will rise, potassium will rise, acid will rise, acidosis, and phosphate will rise. This phosphate will cause hyperphosphatemia. Understood? And what is going to get lost? This thing will be lost. Simple logic. Okay, let's move further. Okay, detail in this part, renal part, will be taught with pharma, because diuretics and action will be seen over here. Basically. Okay, one more thing, ADH. What is the function of ADH? Where does it act? This has been a question. It acts at the collecting duct with the help of ADH, with the help of aquaporin 2. It just absorbs water, salt-free water absorption. Okay, please remember, salt-free water absorption takes place at the level of collecting tubules with the help of ADH. Finally, the blood physiology. See, these are the clotting factor. You must remember the names.